For years, it's been common knowledge in Canada that there is a lack of healthcare workers. At times, when there's a lack of nurses, provinces across the country will turn to private travel nursing agencies to provide temporary staff. These agencies are controversial at the best of times, often paying nurses at least double what standard unionized nurses make. But in Newfoundland, higher wages are barely the tip of the iceberg in a scandal that saw the province spend hundreds of millions of dollars on travel nurses in just a few years. But that money didn't simply come from overpaying nurses. Instead, Newfoundland and Labrador Health Services gave massively inflated contracts to agencies with very little experience and violated the Conflict of Interest Act. While those agencies charged for services that were never delivered, wasted public funds, engaged in fraud, and much more. In this video, how Newfoundland and Labrador spent $241 million on travel nurses in just 3 years, to the detriment of taxpayers and the benefit of staff within the government and private companies. In 2022, Newfoundland was experiencing a significant shortage of nurses in the province, reporting around 600 vacant positions. There are a number of reasons for this, but part of it was a lack of retention. The government introduced retention bonuses, signing bonuses, higher overtime rates, and a number of other initiatives to try and keep or attract nurses to Newfoundland. At the same time, in an effort to fill some of the vacant positions, the province spent $18 million on agency nurses in the first major wave of these types of hirings. It didn't help. The number of vacancies increased from 615 in April 2022 to 752 just 6 months later in October. Many nurses were leaving their full-time positions due to burnout after the worst of the COVID pandemic, or joining travel agencies where they could enjoy hourly wages that were between 2 to 6 times higher. Already, back in 2022, you can see the beginning of a cycle. Low nurse retention rates meant increased vacancies. Private nursing agencies were hired to fill those vacancies, offering significantly higher hourly rates. Many nurses left their full-time jobs to join these agencies, which only provide temporary workers, increasing the number of vacancies and therefore the government's reliance on private agencies. Now, technically using agency nurses doesn't have to be a bad thing. If properly managed, they can quickly fill vacancies and improve healthcare outcomes. Many have praised how they helped fill in shortages quickly during COVID. But Newfoundland did not properly manage these contracts or the costs surrounding them. On average, each agency nurse cost the province $400,000, compared to a mid-career nurse already in the provincial healthcare system, which costs around $118,000. An Auditor General report released in 2025 found that since 2022, the Newfoundland government has mismanaged agency contracts, failing to ensure value for money, or even ensuring that contractual terms were followed and that funds were not paid inappropriately. From April to August 2023, the government spent $35.6 million on agency nurses. In 2024, they spent $132 million. In the first 3 months of 2025, they spent an additional $55 million, projecting an estimated $220 million of spending in 2025. Let's dive into how that money was spent and where taxpayer dollars were squandered. Let's start with the procurement process. The provincial regulations call for agencies to apply for positions through a public bidding process. However, the majority of contracts were signed under emergency exemptions, meaning no bidding process took place and the government gave a contract to a specific agency of their choosing. These exemptions were inappropriate, as the situation did not qualify for such an exemption, and some of the exemptions were added retroactively to justify sole sourcing contracts rather than opening them up to public competition. And the government didn't choose good agencies to partner with or negotiate fair or favorable contracts. Many of the contracts were vague, allowing agencies to charge the government for things that weren't used or for overtime that was never worked. The excessively wasteful contracts are evident in the government's own reporting. Addressing concerns, the government committed to reducing the number of agency nurses to pre-COVID levels by 2026. In February 2025, they said that the number of agency nurses was down 42% from its peak. Yet, as I previously mentioned, between January to March 2025, the government spent around $55 million on agency nurses, meaning even as the number of nurses was declining, the government's spending continued to increase. In fact, the decrease in the actual number of nurses was due to agencies being unable to produce the number of nurses requested, meaning the government simply paid for nurses who never arrived. Some of that spending went straight into the pockets of government employees. Part of the deal with travel nurses is they, travel. Agencies don't simply connect potential nurses with healthcare facilities that need them, they also arrange for transportation and accommodation for those nurses. 49 health authority staff rented out personal property to travel nurses in a total of 53 leases, many of those leases at well above market value. On average, they charged a 90% premium for those properties compared to average rental rates. Those leases added up to a total of $1.9 million. Yet those employees are not required to sign conflict of interest agreements or a code of conduct. Nevertheless, taxpayer money paid for those leases at inflated prices, which directly financially benefited government employees. The government did nothing about this until an external report was sent to the health minister, after which the leases were cancelled. But it was determined that, although unethical, it did not violate the criminal code, so no further action was taken. None of these employees have been disciplined. The AG report focuses heavily on a contract with a company referred to as Agency A. That company has been identified as Canadian Health Labs, a company founded during the pandemic by entrepreneur Bill Hennessy. How CHL became involved with the Newfoundland government points to how desperate the government was to fill nursing vacancies. In 2022, a lobbyist sent an email to the Premier, Andrew Furey, introducing CHL as a company that could provide COVID testing and vaccinations. 3.5 months later, Newfoundland gave a sole source contract worth $28 million to CHL to provide travel nurses, something that they had less than 2 years of experience doing. That $28 million didn't even include expenses, such as travel or accommodations, and was for a single year. Later, it was extended, and another $16 million was added to the contract. CHL was able to exploit understaffed hospitals in Newfoundland during COVID, charging rates that sometimes worked out to $300 an hour in order to bring in nurses from out of province to help meet staffing needs. That's about 6 times what a typical nurse makes. CHL's rates were sometimes double what their competitors charged, yet they managed to win a number of contracts in Newfoundland and later New Brunswick. CHL, which is based in Ontario, sometimes even poached nurses from the public system in Ontario in order to send them to Newfoundland, part of why travel nurses don't help the healthcare system as a whole. They simply shuffle nurses from one place to another. But CHL's founder, Bill Hennessy, wasn't content to profit simply off of providing nurses. He set up separate companies that managed electric car rentals and accommodations. CHL submitted a proposal to Newfoundland's Central Region to rent electric cars for its nurses. The region declined. Despite that, CHL continued to rent electric cars as they proposed and billed Central for it. These rentals included 60 invoices totaling $546,657. This included $91,529 for 81 weeks of electric vehicle rentals for nurses who were not in the province. 60% of the total rental costs, $327,522, were paid for rentals to nurses who either did not have the vehicle or usage by a nurse that could not be verified. The Auditor General's report strongly suggests that this constitutes fraud and requires further investigation. In another case, CHL charged the government $1.6 million for meal allowances, then told the nurses they contracted that they had to pay for their own meals. It's unclear where that $1.6 million went, other than becoming a handout from the Newfoundland government directly into the pockets of CHL's executives. CHL negotiated rates of between $283.63 for general RNs and $312.25 for specialty nurses. The nurses themselves were paid between $85 to $100 an hour, meaning only about 1/3 of what the government paid actually went to the nurses. Bill Hennessy's real estate company would purchase properties in cities where CHL was providing nurses, then rent those properties to those nurses. In one case, his company purchased a 7-unit building in New Brunswick, where CHL also provides nurses, and terminated the leases of the tenants already living there in order to rent to travel nurses at higher rates, paid for by the New Brunswick taxpayer. Most of the evicted residents were in their 70s and 80s. It's easy to point specifically at CHL because of how seriously they mismanaged public funds. But across the board, Newfoundland had no coherent plan for travel nurses. In general, the Auditor General's report found that NLHS had not completed audits that would have helped them to understand the situation in detail. Instead, they threw money at private nursing agencies, hoping they would fill the gaps without really understanding what those gaps were. At the same time, they neglected nurses already in the public system, and underutilized or misused casual nurses, who could have helped to fill gaps at a much lower cost. Many provinces and unions across the country are calling for a ban on travel nursing, saying that while it tries to quickly address the issue, it's not sustainable or a long-term solution for nursing shortages, and in fact makes the problem worse. Representatives of Newfoundland's nursing union contended that nurses in the public system had been denied benefits, overtime pay, and professional development, while public funds had flowed freely into the private sector. Healthcare has huge influence politically, and governments often try to patch gaps quickly to make it appear they are keeping healthcare running smoothly. That's part of how companies like CHL were able to exploit Newfoundland's government so easily. The government needs something that seems like a solution, and they need it quickly. The current Premier of Newfoundland, John Hogan, was previously Health Minister and Attorney General. Yet even weeks after the Auditor General's report came out, he had yet to make a statement. There are some positives in the report. In August 2024, NLHS submitted a request for proposal for agency nurse contracts, rather than giving sole source contracts. The following March, they awarded 17 vendors standardized contracts, meaning that no one agency, theoretically, should be able to exploit the government. Public employees are still allowed to rent their properties to private nurses, although they should be used as a, quote, last resort, and should be reminded of the Conflict of Interest Act, which doesn't exactly inspire confidence. In May of 2025, the Department of Health and Community Services released the first phase of a 10-year plan to increase recruitment and retainment of various healthcare occupations, among other things. And while all of these things are promising, spending on agency nurses is still, so far, at an all-time high in 2025. Even if the government puts together a coherent and reasonable plan going forward, they still have to untangle themselves from the previous bloated contracts and restore public trust. Not to mention, find the money to treat public nurses in a way that will lessen burnout and increase retention. All of this while contending with the lobbyists, private interests, and even government employees who have profited off of this system, while taxpayers have paid more and more for increasingly poor healthcare. Reducing reliance on agency nurses will mean solving some of the tough questions around healthcare that are stressing the system across the country, something that will take much more than shipping in overpriced nurses from somewhere else.